students, welcome to our science class. Our chapter name is safety and first aid. In the last class, we discussed about different topics in this chapter. And our last topic is what? The topic was about the burn. Cause of burn, different types of burn, and what first aid we want to do for this burn. All the things we discussed in the last class, and now we are going to discuss the further topics about the different fractures, sprain and all. So first we are going to discuss about the fracture. Fracture. What is this fracture means? You may heard this fracture somewhere. When we run, we get fall and the fracture occurs in our hand or in our leg. Like we will say like that. So now the question is, what is this fracture? Now we are going to study what is this fracture, and the definition is this. It is a crack. It is a crack or a break. It is a crack or a break in a bone. So this is the definition for fracture. That means it is a crack means very small break, and this break means big one. That's so we are calling it as fracture. It is a crack or a break in the bone. It is what? Fracture. And it may occur with the accidents. With some accidents there occurs fracture sometimes. There are different types of fractures. Now we are going to study which are the different types of fractures. Fracture are basically of two types. Fracture are basically of two types. The first one is this simple fracture, and the next one is compound fracture. Compound fracture. So there are two types of fractures. The first one is simple fracture and the second one is compound fracture. So now we are going to study in detail about the simple fracture and the compound fracture. As it's the name, this simple fracture is actually something simple, means that is not having such complications with the simple fracture. So now we are going to look what is this simple fracture. Simple fracture. This is a type of fracture, and here only bones break. Here only bones break. Then what is the something that makes something problem here? The other thing is around the bone is what? Our tissues and muscles. So here the tissues and muscles around it do not damage. Do not damage. So these are the two things about this simple fracture. Here only the bones are breaking and the tissues and muscles do not damage. That is about the simple fracture. And the next one is this, the compound fracture. Compound fracture. But here something is different than the simple fracture. The thing is this, here the breaking of bone occurs. Bone breaks. And also the tissues and the muscles around the bone also damage. Tissues and muscles also damage. So this is the first difference between the simple fracture and the compound fracture. In the simple fracture, only bones are getting break and the tissues and muscles do not damage. But about this compound fracture, what happens? Both the bones and the tissues, muscles, all the things are getting damaged. And so, sometimes in this compound fracture, the broken pieces of bone may get separate completely. Here, broken pieces of a bone may get separate completely. Sometimes, we are not saying that always the broken pieces may get separate. In some cases, there happens that the broken pieces of bone get separate. That means this compound fracture is something complex. And here, this is something, it's okay with this. Okay, not, but this is something simple and that is complex. So, this is about the simple fracture and the compound fracture. Now, we are going to discuss what first aid we want to give for this. That is the next thing we are going to discuss. So, the next thing is this, the first aid for this fracture. First aid. Before reaching hospital, we need to do certain things for this fracture. And actually, the basic thing we are doing for this fracture is, we are making these bones not moving. That means we are preventing the motion or the movement, of the broken bones or the bones or the affected area. We are preventing the movement of the bones. That is, we are going to do in the first aid. For that, what we want to do, the thing is this. Just take a magazine or cardboard piece or wood, etc. Just take a piece of magazine or cardboard or wood and just tie it with the affected part. For example, here I have one scale. I have one wooden scale. And so, if the affected area is this hand, what we do is that we just tie this scale with our affected region. If I tie this, what happens? Then my bones will not move by tying this. So, that is the thing we are doing in this first aid for the fracture first aid. That is, for that, take a magazine, a cardboard or a wood and tie it around the fractured part. Tie it around the fractured part. So that is the first thing. So here we said that we are just tying the scale on the hand and we call this scale a name and that is called splint. S-P-L-I-N-T. Splint. You want to remember this name. Splint. Splint means when we are binding or tying a piece of magazine, cardboard, wood or anything that we are tying in our hand for preventing the movement of bone is called what? Splint. That is the thing. So, I think it's clear for you. That is the first point. And the next thing is this. If the fracture is there in our hand, we want to tie this piece of wood or something. That's okay. And do another thing. We want to take a piece of cloth. Take a piece of cloth or band-aid bandage and tie this. That means you can see that a piece of cloth is just tied here and that will tie in our neck. Why we are tying it like that? The reason is this to prevent the motion of our bone. When we tie it like that, our hand will be close to our body and then the movement will be not able. That's why we are taking a piece of cloth or bandage and just tie it. That means we are just tying it like that and we will tie it in our neck. That is the thing. So, that is the first aid for the fracture if it occurs in our hand. Fracture in our hand. And we already said that a piece of cloth or bandage. And this have a name and that is called the sling. S-L-I-N-G. What we studied in the previous section about the piece of wood. The name is this S-P-L-I-N-D. Splint. This is splint and this is sling. Never get confused about this. This is the piece of magazine or the wood or like that. Splint. That is the thing that we tie together with our hand. Not only hand, for our legs or anything. The aim is this, it will prevent the motion of our bone. And what is the sling? Sling means the piece of cloth that we are giving support to our bones. That is the sling and the splint. Don't get confused with these two things. So this is about the hand fracture. And the next is, if the fracture is there in our leg, what we do? Again, we tie a splint around the fractured leg. We tie a splint around the fractured leg. We tie a scale, that is the splint. We tie a splint around our leg by to prevent the motion or the movement. And also in your textbook they are also saying that we have to keep our leg above the heart. That means simply it means that don't move the fractured leg. That is the meaning of this. So these are the first aid that we are giving for the hand fracture and the leg fracture. There is also another points are there. The next is this. When the fracture occurs, what happens? They have pain. Pain is there. And also swelling is there. Pain is there and swelling is there. And so we can reduce the pain and the swelling. How? We can reduce it by using ice packs. Ice packs. We just take a pack of ice and just put it around the affected region. Then what happens? Then the pain and the swelling will be get reduced. We are not saying that the ice have to be put directly. This ice pack means something we are wrapped with this ice cubes. That's what this ice packs. So in the last region we already said that just take a kerchief, put some ice cubes and just hold it and put it around the affected region, like all the things we already said. So in the similar way here, this ice pack is something available for doing this purpose, and so we can say when there is having pain and swelling, just take the ice packs and just put it around the affected region. That is the next point. So if we do like that, the pain and swelling will be get reduced. The next point is this. Take the patient immediately to the hospital. Take the patient immediately to the hospital. Actually, we are not saying that this first aid means something we are treating someone or we are giving some medicine someone. Not like that. Actually, we want to bring the patient to the hospital. But before that, we are giving certain special care for that person, and that is what? That is the first aid. So, for the fracture, even if it's simple or compound, we want to bring that patient to the hospital. And this all will reduce the pain of that person, and that will reduce the damage for that person. That is the only thing that done by this first aid. So, this is all about this fracture. The next is this sprain. What is this sprain? The next we are going to discuss this. And sometimes when our ankle or our waist is getting twisted, that means when our hand is getting twisted or our leg is getting twisted when we are walking, and at that time our leg feels pain or our hand feels pain and gets swelled and all, and that is what? This sprain. So we can say it as sometimes our ankle or wrist may twisted. At that time our tissues are getting damaged. Our tissues get damaged. How? Due to the sudden jerk. Due to the sudden jerk. So, that means we are saying that what is this sprain? And for this ankle or waist may get twisted sometimes. And at that time, our tissues get damaged. How? Due to the sudden jerk for these tissues. And that we are calling it as sprain. And here, because of this, there cause swelling. There occurs swelling and severe pain. Severe pain. There occurs swelling and severe pain. So, this is called what? Sprain. This is the sprain. So, sometimes our ankle or wrist may get twisted, and at that time the tissues get damaged due to sudden jerk, and at that time we have swelling and the severe pain may occur, and this is called what? Sprain. Here no such breaking or nothing will happen. Only the pain and the swelling will be there, and it will be okay with some days. So that is the sprain. Now we are going to discuss what is the first aid we want to give for this sprain. That is our next thing we are going to discuss. First aid for the sprain. First aid. So, for this, here also we want to use ice packs. Here we want to use ice packs to reduce swelling. Here we want to use ice packs to reduce swelling. That is our first point. The next point is this. There are pain relief ointments are there. So the next point is we want to use such ointments. Use pain relieving ointments. So that is the second point. First we want to use ice packs to reduce the swelling. The second point is this: use pain relieving ointments. The third point is this: put bandage around it. Why we are putting bandage around it? We are using it to prevent the movement, of bones. These are the three first first aid points that explained in your textbook. First thing, we want to use ice packs to reduce swelling. First thing. The second thing is this. Definitely when the opposite twist, what happens? They will have the swelling and the pain also. For that, we want to use pain relieving ointments. And the third point is this, put bandage around it. If the affected region is this, when we are just leave it, what happens? It will move freely to all the sides. So, when we are just put bandage on this, what happens then? It is unable to move for this hand. That's why we are using the bandage around it to prevent the movement of warts. So, this is about the spray. Our next point is about the animal bite. There are different types of animal bites are there, and for each animal bite, it is having different effects in our body, and also we want to do different types of first aids. And in your textbook, only 2 types of bites are discussed about the animal bite for the dog bite and also for the snake bite. These things we will discuss in our next class. Now you want to read your textbook 3-4 times and also want to complete your notebook. We will meet in our next class with the further topics and we will conclude this chapter.